So I'd like to introduce myself. My name is Sue Sweeney, and I'm the program manager of the Best Practice Spotlight organization with the Long-Term Care Best Practice Program. And I'm joined today with Janet Chee, our associate director of our Long-Term Care Best Practice Program. So today's session are going to cover an overview of the Best Practice Spotlight organization designation program. We're going to describe the eligibility requirements for organizations interested in applying for BPSO long-term care designation who are in the process or considering joining the Clinical Pathways Program. We want to identify the impacts of BPSO as described by BPSO leaders. So we'll be joined by an individual who has actually implemented both clinical pathways and joined the BPSO movement. We're going to review the pre-designation BPSO long-term care deliverables, discuss the application process and the related timelines, and we're going to identify how RNAO is going to support you in this process. And at the end, as I mentioned, we're going to have opportunities for questions and discussion. So I'm not going to go into great detail in the next couple slides, just because if you've been in clinical pathways, you've seen some of these slides before. But RNAO is a professional association of registered nurses, nurse practitioners, and nursing students in Ontario and Canada. We're a strong, credible voice. We have over 51,000 members. And so we like to influence and promote healthy public policy and clinical excellence. Our best practice guideline program is an important element. And we develop, disseminate, and actively support the uptake and sustainability of evidence-based clinical and healthy work environment best practices. And we help to evaluate their impact on residents, organizational, and health system outcomes. And we are funded by the Ministry of Health. Our best practice guideline program is an important element, and we develop, disseminate, and actively support the uptake and sustainability of evidence-based clinical and healthy work environment best practices. And we help to evaluate their impact on residents, organizational, and health system outcomes. And we are funded by the Ministry of Health. So this is a model of RNAO's best practice guideline program, and it shows three integrated pillars within the program that are connected to one another and ultimately lead to positive outcomes. So we have the guideline development. Best practice guidelines are developed using a rigorous methodology. We have dissemination, implementation, and sustainability, which we'll be talking about later on, and we have monitoring and evaluation. So the long-term care best practice program, the goal is to improve resident care outcomes in Ontario. And as you can see, it is part of the dissemination, implementation, and sustainability wheel. So when we're looking at implementation methodology, Best Practice Spotlight Organization designation and BPG Clinical Pathways are actually on the organizational level of the dissemination, implementation, and sustainability wheel. So it really does help you bring best practice guidelines to the front line care. So best practice spotlight organizations influence and uptake sustainability of best practice guidelines across healthcare and academic organizations to enable practice excellence and positive client, organizational health system outcomes. And I have to tell you, as a coach, it's been amazing the impact that we've seen with BPSO and the changes that have been made on organizational, but also on a personal level of individuals who are involved in the program. So we ask you to partner with RNAO for a minimum of 3 years, and we want you to focus on 3 clinical BPGs, and it takes 3 years to attain your BPSO designation. And we have these 5 elements of the methodology. So Janet will definitely get into the nitty-gritty regarding these, but we have BPSO infrastructure, capacity development, system implementation of RNAO BPGs, monitoring, evaluation, and dissemination. And so once you're designated, then we look at sustained use and how you can expand and spread and mentor others. So in Ontario, we have over 90 long-term care homes who are involved in best practice guidelines, and we have one host agency who actually has multiple long-term care homes underneath them. And this is this is all of our organizations who are involved in the BPSO program presently, and we look forward to seeing uh, your name up here in the future. There are 1,500 BPSOs throughout the world, spanning from Chile to Australia to China. And so it is a social movement. And it's amazing to see the impact of these evidence-based best practice guidelines. And they're free and available online. And that's why we've been able to spread it throughout the world. Right now, I'd like to take a moment to introduce Suzanne Gordon. And she is the Assistant Director of Care at NIFU Community Tri-County Mennonite Homes. And she's going to talk about her experience with both BPSO and clinical pathways.
Everyone, I hope you can hear me. Can hear me okay?
Yeah, great.
Great. So I just wanted to, again, I was going to introduce myself, but you did that. So I'm Assistant Director of Care at NIFU Community. And here we have accomplished BPSO, graduated, as well as we are implementing clinical pathways. And so what I would first say, one of our first feelings, and I wasn't here for the initial BPSO piece. I want everyone to know that. But the similar message to when we looked at clinical pathways was it's so long, 3 years, it was so big, but really it's just, I wanted to say, broken down in such manageable pieces that it doesn't feel as though it's going to be that overwhelming. So I wanted to just let everyone know that, because I know you mentioned it's a process, 3 years. So we have both BPSO designation and clinical pathways. So some of the benefits I was thinking about before coming and speaking to you is the biggest one is the enhanced resident care. We are looking at best practice. We are looking at cutting edge, leading, knowledge and education for our residents. Improvement in quality of care and resident outcomes. We manage data, we follow and track, and we can see the actual numbers, which is a nice way to make sure that we are, doing what we want to do and it's working for us. It's in alignment with legislation and then your regulatory bodies, the act, the regulations, it all comes together quite nicely, and it actually makes using each individual part much easier. We have improvement in staff efficiencies, staff accomplishments in providing care, staff buy-in and trust in our leadership team and in the facility, because we actually use the entire team. Everyone's involved. We started both BPSO and then clinical pathways very early on, starting to talk the language, bulletin boards, memos that went out right from senior management down to really every area in the whole home, because they'll all hear it and we're all going to be part some way of that. Reduce risk of errors. So we are always tracking errors and wanting to minimize. And I think that really has been an excellent way, again, BPSO and clinical pathways, reducing those errors. And we're seeing those in some areas like falls, skin and wound improvements. We're just looking at pain right now, and we know that pain is something really not managed well in the senior population. So we look at those pieces that we know the ministry is looking at, that our quality improvement plans are going to be based on. Now we get some structure and support into how to do that. So that's been excellent. We're building capacity at the bedside. So we're providing the education, the support. There's posters on the walls about all of, the best way to do and how to do. And then it's also, so that goes into our reduction of errors, hopefully, and that's what we're seeing, but also a real trust in that they'll come to our leadership team. So our nursing leadership team is very hands-on. We're on the floor, we're doing things with the staff. And so that relationship to come with us and not be afraid to say, I'm not sure, or not sure this is going well, or we need to make some change, and can you help me? So that capacity and relationship building has it's just taken off. It was more even than we could have assumed or hoped for. And then it's really the pathway, or the trajectory as we call it, for BPSO and clinical pathways really kind of mirrored each other. So implementation, planning, early communication, everyone knows, through to then the education portion to make sure that people understand, because we're all at different levels and we're not all nurses or healthcare. And then with the staff education piece, really that was where we saw their involvement coming. There was a synergy between BPSO clinical pathways. Oh, I heard that in the BPSO, or I read that. Now I'm reading it again in clinical pathways. It's sort of the same. So it tends to lessen that feeling of overwhelmed. Oh, we're doing two things, they're big. Actually, we're doing almost the same thing from the same source with the same support. You know, we're looking at the similar expectations of the staff. So they're not feeling like they're the innovation fatigue, like we talk about, like there's more and more expected of me. Actually, it's almost the same thing. Same support, same words. So that's been really great. The go live was a big launch, which is always supported by RNAO. The coach would come, the coach has come and visited, and pictures, and really just celebrating wins. And that was what we found really, really helpful at the end of both, was that we could look back with the staff who'd been involved and show them where their wins happened and what change was driven right from that, from them. So then the evaluation sustainability, again, that's part of the 3-year process. And we should be doing that for every sort of initiative that we do. So that's not unusual. You know, when we look at project management, for example, if we don't evaluate, we shouldn't do it. And we are evaluating everything. This is just another piece. And when you're doing both together, you do that at the same time too. So we find that, yeah, that's been really helpful. Key points too is encouraging the involvement of frontline. Get your staff excited, have them understand the language, and then find your champions, the ones who rise up, the ones who come. It's always amazing to us when we've had champions, then they want to do more. Then they want to join other things. Then they want to be more involved. And so you really grow a capacity in that relationship and teaching and education. And yeah, it just makes them want to come on board for everything because we've accomplished, they've done it, right? And we can show them what we've done. We want to show them to, one of the pieces that I did personally was go out and show them how this improves work for them, how this affects them, not just the residents, which of course is front and center, but also staff. They need to see what the benefit is to them. They need to see how this is going to maybe make their job easier or make them feel better at the end of the day, that they know what they did was right. And they had the information from clinical pathways to know what choices to make, to know what to do. And BPSO just gave us the framework in which to do it. So that was really key for our staff too. And everybody should get involved. Housekeepers, dietary, everyone takes care of our residents. So we made sure that when we were doing education rollout, we would bring them in as well. This could be your role. This could be a part for you. You know, we want that. Then looking at not just a gap analysis of what was missing, but also the barrier to your success. So what can trip your project or your initiative up? What's going to be those kinds of barriers? And that may be on a higher level, whether it be time, whether it be personnel, human resources, things like that. So that barrier piece we found really, really helpful. And if we do that kind of upstream, then when things rolled out, we thought, yeah, we thought about that. And you have capacity for the things that you hadn't actually thought about that you sort of bump into as you go. Yeah, and then really making sure that we're speaking the language of BPSO, using the terminology that we've introduced, elevating sort of everyone's understanding to that. And that's not easy. We all have lots and lots of different languages and cultures, but finding a way for us, the success was finding a way to help them understand it. Not just this is what we're doing, but why are we doing it? How's it going to help you? And do you understand the terminology behind what we're doing? So, so those were kind of our keys to our success. Yeah, and it just, for us, BPSO and clinical pathways just fit into what we saw as our goals and strategic plan for NIFU, where we were going to kind of make improvements. So, I think it would be, for me, I think looking back now, it would be really difficult to have done clinical pathways without all of that BPSO information and support and knowledge. I think they're really key to have a symbiotic kind of relationship. It just makes sense with all the support available to do that.
That's great, Suzanne. It seems like capacity building is a huge part of BPSO and really helps support your clinical pathways.
Yeah,
If you
yeah,
had
it does.
one tip,
Mhm.
what would on homes that are implementing clinical pathways and considering BPSO, what would your tip be?
I think the biggest piece when you're looking forward is just that building capacity. What are we able to do? It's okay if you are building it, it's in smaller chunks maybe than what your kind of the whole big initiative might look like, but it's really building that capacity. Who do you have that you maybe haven't thought of or haven't given an opportunity to, and have that come forward, and then really forge that relationship with your coach, with having that person that you can just pick up the phone and not struggle. I think struggle slows down progress, a bit of panic and anxiety, and what do I do next? And I think that tip is just really have a close relationship with that coach to get that information, and your clinical pathways coach as well. And we had some amazing clinical pathway coaches for sure that just can kind of relieve your mind quicker than trying to sit and struggle with any of the other things that we've maybe tried to implement. But yeah, it's talking the talk every day is the other thing. Really staying on top of it and having your staff feel that you're in it with them. You haven't pushed it downstream and you're done and they're going to fix it. It's just that capacity in all areas, I think, is my biggest tip. And then finding the small wins, the little things all the time that you can say to staff, look what we did, look what we did, look what you did, look at the change. And so those small wins are key. Yeah, that's what I would say.
Well, thank you so much, Suzanne. We appreciate you sharing your experiences with us, and thanks and have a great afternoon. Thanks for
Great.
joining
Thank
us.
you. Yep. Thank you so much for asking. Have a good day.
Hand it to Janet now, and she's going to talk about eligibility criteria and the deliverables.
Thank you so much, Sue, and thank you, Suzanne, for bringing your experience of the two programs. And that's really what I'm going to be focusing on over the next remaining time that we have, is really talking about the overlapping synergies between BPSO and clinical pathways, and how being part of clinical pathways actually makes your BPSO journey much easier. So this beautiful Venn diagram really highlights the fact that the two do have overlapping components. And in the reality, the overlapping components are actually larger. And it starts with, what is the goal of the two programs? And the goal of both programs, BPSO and clinical pathways, are the same. When we look at the goals of implementing best practice guidelines, that's foundational to both programs. The goal of supporting compliance with Fixing Long-Term Care Act, ensuring systemic and implementation, really looking at who is these two programs going to benefit. And both programs, BPSO and Clinical Pathway, are meant to benefit and improve resident outcomes and also staff efficiencies. Both programs are really meant to support and engage residents and families, and also looking at developing an evidence-based culture. And so being part of clinical pathways is already actually you're doing a lot of what BPSO is required. And so this is a nice table that really outlines the 5 areas. And I'm going to go through each of these 5 areas that are part of the BPSO methodology and deliverable requirements. And just to show you, clinical pathways actually checks off the majority of these big deliverables. And so the infrastructure components, implementation of BPGs, as well as a big chunk of the monitoring and evaluation components. And so I will go through each one of these and really highlight what is the work that you're actually already doing versus the work that is a little bit more unique to BPSO. So I'll say upfront that we have already posted the RFP for the BPSO. It is one RFP for everybody, regardless of whether you're implementing clinical pathways or you're a home that hasn't. The difference is that we want to recognize the hard work that homes that are implementing clinical pathways that you've already done. So we've created a kind of like a fast track where even though the RFP is the same for everyone, if you have already implemented or are going to be implementing clinical pathways within the next 6 months, you will have an application that is half the questions of everybody else. And we did that for a few reasons. For one, you already have a contract with RNAO with clinical pathways, so we know you. Secondly, you're already implementing guidelines, so we know the work that you already have been working on through clinical pathways. And then third, you're already submitting data to the Enquire system. So these were the big rationales for us to say, you know what, I think that this is an opportunity to really help homes that are implementing clinical pathway really fast track into BPSO. So let's go through the nitty gritty of the deliverables. So as Sue had mentioned, these are the 5 deliverable categories. And the methodology for BPSO is purposeful. Each one of these are based on guideline implementation methodology, based on rigorous research. And so each one of these are built to support implementation and also sustainability. These are also the same methodology that is currently being used in clinical pathways as well. So these, you will see the next few slides, are going to be very similar to what you are already doing. So the first, I would say, component of BPSO, and one of the most important, is building an infrastructure. So this is really about building an infrastructure to coordinate and to communicate the work that's required to complete BPSO. The fantastic part is you've already built a governance structure through clinical pathways. So I'll have to say upfront that over the last, I would say, 1.5 to 2 years, we've had homes like those that Suzanne is from, NIFU, where we've really learned, what is the best way to have a coordination between BPSO and clinical pathways. So they were the homes that we trialed many different processes with, and we've really realized that instead of treating BPSO and clinical pathways separately, like 2 separate projects, it's actually best to use the same governance structure. So you're not duplicating any work, you're not confusing deliverables, and you're not overdoing too much. The reality is, if you use your existing infrastructure, then you could actually save a lot of time with BPSO implementation. And so whomever you have for your leads can stay the same. Implementation teams, we may need to have a look at your steering committee and see if it has the right representation. But very likely it's probably spot on for BPSO as well. You are already dedicating financial resources in kind and otherwise to clinical pathways. Those would be the same resources for BPSO. And then, of course, you're already working on sustainability and ensuring that all your records are stored safely. So for me, you are already actually doing this work of building an infrastructure. You already have it in place. So I have to say, I stole this slide from Rita, which many of you know. This is the governance slide that she uses to really talk about the governance structure for independent homes. So whatever structure you've already created is one that we can utilize for BPSO. The second big pillar of the methodology is capacity development. And that's what Suzanne had mentioned, is the importance of building capacity. Now, what that means is that neither clinical pathways or BPSO can be a one-person project. It involves everyone in your organization. So what we do at RNAO is we help you with getting everyone on board. And so you may have already built a group of champions or individuals who are working with clinical pathways, and we would work to continue and expand what you already have. And one of those ways that we expand is through the champion program. And so one of the deliverables is champion development at 20%. And so I'm going to talk about that a little bit more, but this is really comes from the evidence that says that when you have a certain percentage of your staff that are on board and are champions, that helps with implementation and it helps with sustainability of change. And so, this critical mass of 20% is vital and it'll be synergistic for both your clinical pathway project to make it more successful, as well as BPSO. And so a lot of what we do at RNAO is we support this capacity development through a variety of free and paid events. Many of them are supported by RNAO. And so we have things like our launch event, the orientation. And so you won't just start the project and then run off. We have a big launch and you will meet other homes similarly like you had the launch for clinical pathways who are on the same journey. So you'll get to come to Toronto. We will introduce you to the BPSO program and you'll get to meet others who are also similarly on this journey. And I'll use the next few slides to really highlight the other components. But one of the big tips I have here is use your existing and new champions to move both your BPSO and your clinical pathways forward. So BPSO, or Best Practice Champions Network, the network is really about gathering a group of individuals together to really learn about the champions methodology. So champions learn about implementation, how to implement, how to engage their colleagues for implementation. And this critical mass of 20% is really meant to help each of you with implementation. I'll just also mention that we have multiple ways to help you train 20% of your team. We have in-person champions workshops where we have our coaches, many of them online today, can come to your organization and deliver champions workshop. We also have online blended learning series for staff to also attend online as well. And so we have lots of avenues to make sure that you can get your 20%. We also have here, we have monthly knowledge exchange meetings that are virtual, where you can connect with other homes, very similar to the knowledge exchanges that you already have with clinical pathways, but more specifically related to BPSO and learning from each other in terms of how to move forward deliverables. And we also have an annual BPSO Knowledge Exchange Symposium. The next one is happening in London this fall. And this symposium is really for BPSOs worldwide. So both long-term care and other sectors, we get together. It's a conference where we share each other's work and we learn from one another and network. So it's a really exciting activity. You can see here, everyone's waving flags, taking pictures, smiling. And so we want you to be part of that as well. We also have another really great event. It's called the Clinical BPG Institute, which I would say is the Champions Workshop, but more in depth. And it's a 3-day event. This year, it's going to be at the White Oaks. It's a great opportunity to send your leads, your co-leads, and key individuals in your organization that are really important to both clinical pathway and to BPSO implementation. And this event isn't exclusive to BPSO. Actually, anybody can send their team, their staff, their leadership to this event. And so I will make sure to send to Rita the marketing that we're going to be sending out in the next week or so for the event coming up at the end of October at the White Oaks, which is Niagara-on-the-Lake. And then Advanced Clinical Practice Fellowships. And so this is an opportunity where you can receive funding, and this is regardless of whether you're a BPSO or not. You can apply for funding to support projects that you're working on. And so through this fellowship, you would have a staff member from your organization identify a project, and you can select one of your BPG implementations to be that project. And they can apply for a fellowship grant, and you would receive, I believe it's 15,000 for your organization to implement that project. And you could use that for education, for resources, for tools, for conferences to support your work. And then final part of the deliverables. So for ACPF, you need to submit an application for ACPF. And then finally, you have access to an RNAO coach. So just like you have an assigned clinical pathway implementation specialist, you would also have a long-term care BPSO coach. They are assigned to you to help you through the process, to work with you on a weekly basis to keep you on track, identify areas that you need to move forward. And the coach from BPSO and the implementation specialist also works together to ensure to streamline your work so you don't have duplication. And we've worked really hard over the last year to ensure good communication between our specialists and our coaches, and to ensure all of our BPSOs and homes that are implementing clinical pathways have reduced confusion and improved efficiency with moving forward both projects. So the third component of implementation is really looking at what is the requirements. So the first is we utilize the same methodology as clinical pathways for implementing BPGs. We use the Leading Change Toolkit, so this will be familiar to all of you. We use the two complementary framework, the social movement action framework, which is about engaging people to be part of the journey, and then the knowledge to action, which is about contextualizing the guideline for your organization. And so you've already had this education, you've already worked with your teams. We would continue that expansion to build capacity to move forward BPSO with the same methodology. So in terms of guidelines, the key tip here is any guideline that you're already implementing through clinical pathways counts as a guideline implemented through BPSO. And so that work of implementing those guidelines through clinical pathways already actually counts towards BPSO. So you don't need to do additional or extra. Now, there's a little bit of nuances here, so I'll just explain. So for BPSO, you need to implement 3 guidelines. 2 of them are mandatory: transitions in care and services, as well as person and family-centered care. So one of the first guidelines that you've already implemented is resident and family-centered care. So that guideline is already on that list that is required. And then a third guideline you get to choose based on the priorities of your home. Not only for this systematic implementation do you need to implement 3 guidelines, but also submit your paperwork in terms of your gaps and your action plans. And so a lot of those things you're already doing with your implementation specialists. So I would say that for this requirement, you're already done or are going to be doing it. And so there's really 2 scenarios. The first scenario, if you're just starting with clinical pathways, you're either implementing now or you're on a cohort track to implement over the next few months, I would say that, and that's this first top pink box here, that the 3 guidelines that you would need to implement are transitions in care, person and family-centered care, and then you'd pick a third guideline. Now, if you're one of the older clinical pathway cohorts that's already implemented PFCC, then you would pick 3 different guidelines. So you would still need to implement transitions in care. And sorry, you would pick 2 additional guidelines. The thing is, you could just pick guidelines that are already on your cohort track for implementation. So this is a slide. Again, I stole this from Rita. This shows the trajectory of the different guidelines for implementation. And so if you've already implemented, let's just say, these guidelines, and you're one of the first cohorts, you've already implemented RFCC, delirium, pain, and falls, and you're coming into BPSO, then you can just pick transitions in care and 2 guidelines from the next group of guidelines that are slated for you to implement. We've also had situations where we have worked with individual BPSOs to help them based on their priorities. So we have one home that had implemented the first guidelines here, but then they said, palliative and end of life is a real big priority for us. We really need to implement that now. So we've worked with Rita and her team to help get them the palliative and end of life modules, to help them both with their BPSO deliverables, but also some of their clinical priorities. And so this is where we work with each home to make BPSO and clinical pathways work together. There is no one rule. We work together, the specialist and the coach, to make this as streamlined and easy for you as possible. The second to last is monitoring, evaluation, and research. So I'll just be truthful and put it out there. One of the biggest challenges that many of our BPSOs talk about is we need to submit this data. The fantastic part of clinical pathways is that clinical pathways collects data on the back end through the clinical pathways system. And so that data that you're submitting for clinical pathways absolutely aligns with the data that you need to send for BPSO. And so you don't need to do double reporting. So we, on the back end of Enquire, streamline the data submission process. There are other reports that you will need to submit. So I'll just tell you up front that there's also HR indicators that you'll need to submit and narrative reports. I am working with Rita to see how we could streamline the narrative reports as well for our homes or implementing BPSO and clinical pathways. But I would say on this slide, the majority of the heavy duty work is actually the Enquire data submission, which if you're already submitting data through Enquire, through the Clinical Pathways Program, then you're actually submitting the majority of what needs to be done already. Okay. The last piece is dissemination. And so dissemination is about sharing your successes. It's about saying and telling other long-term care homes, look at what we've achieved, and this is how we've done it. And that's what RNAO is about. RNAO is about sharing widely so that other seniors and other homes can benefit. And that's one of the big things that our coaches love to do in working with our long-term care homes is say, what are you the most proud of? And how can we tell everybody about it? And the telling everyone about it could look a number of different ways. It could be presenting at a conference. It could be publishing an evidence booster. It could be participating on a committee or writing an impact story. There are many, many ways, and our role is to help you to be able to do that. Many times, myself and Sue will meet with many of our BPSOs on a biannual basis for our reports, and we'll hear about the amazing work. And we always try to encourage our BPSOs to share because the outcomes are phenomenal, both qualitative and quantitative. So there's opportunities for you to share, and you would need to share once a year. So you can pick from this list, this pick list, which ones you want to do. You could pick a different one every year or a combination. One of the key pieces of dissemination is having a BPSO launch, also known as have a party to launch your BPSO initiative. We love going to parties, and so we encourage you to launch, encourage you to invite all the people in your organization to attend and to really learn about BPSO, and we can help you through that process as well. Submit a manuscript. So submit a manuscript is a separate deliverable that's required, and that involves writing an article to go into either a peer-reviewed or non-peer-reviewed journal. And so we have lots of wonderful examples of homes that have shared their stories in a variety of different magazines and journals. And then the last piece is really about telling people that you as an organization are a BPSO, either through social media, through your social media, through your website, as well as in your organization showing public visibility through pull-up banners, signs, and other means as well. I will say that many of our homes love making BPSO t-shirts. It really fosters a team environment. So when champions have a t-shirt, they've actually had like BPSO t-shirt Tuesdays, and everyone comes with their t-shirt, and it celebrates a collective identity. And so these are some examples of things that homes have done to really highlight BPSO. Many of our organizations say that being part of BPSO is transformational. Not so different from being part of Clinical Pathways is also transformational. So these are some nice social media posts as well. So we talked a lot about what are the things that an organization needs to do to be a BPSO. But the reality is BPSO is a partnership. It's a partnership with RNAO. And we also similarly in a partnership have responsibilities. We want each home to be successful. We want each home to graduate, and we have a graduation ceremony each year at the RNAO AGM. And we have quite a few resources to help each home be successful. So first, you would have a dedicated BPSO coach. I see some coaches here. We see Tanya, she's got her camera off, wave. We've got Susan McCrae, Sue Sweeney, Jen Bahoon, Jen disappeared a little bit, but I know she's there. We've got Brandy and Midge and the two Julias, Julia Mason and Julia Fineshko. You may have met some of them already. If I've missed anyone, I apologize, but everybody gets a coach. And so we will assign one that's in your area. Oh, Danny's coming up soon. And so you will have both your BPSO coach as well as your implementation specialist to help you. We also have, as I mentioned, an orientation where you come to Toronto and we orientate you to the BPSO program. You get to meet your coach in person for the first time. You may have met your coach already through other activities, but it's a nice way to get together, to learn, and then also to network. Of course, I had already mentioned lots of champion development opportunities, so online and in person. And so don't worry, we'll help you get to your 20%. Lots of facilitating network and knowledge exchange meetings, so lots and lots of sharing. And the great thing about our sharing is we share both successes, but we also talk about brainstorming some challenges. And so this is the opportunity where everyone can learn from one another through peer-to-peer learning. If we have research opportunities, we always bring them to the forefront to our BPSOs. And of course, we have lots of opportunities similar to this webinar to help homes disseminate their work. So Suzanne came and she shared wonderful tips and background about her experience with BPSO and clinical pathways. So she actually gets to count that as a dissemination today. So I think she'll be happy with that. So really quickly, the application process. So as I mentioned, it's the same RFP. The RFP is being uploaded today onto our website. So I encourage you all to go and to pick it up. What will happen is I will need any home that's interested in becoming a BPSO. The first thing you need to do is send a quick email of a letter of intent. And that letter of intent is meant to say, hi, my name is, let's just pick Teresa Dupuis from XX Home, and I'm interested in BPSO. You fire that off, and what that means is we're going to put you down so that on the date that the online submission opens, you get an email and then you get access. So your letter of intent is not binding. So it's not like I'm going to come back and chase you and be like, where is your application? You promised me. It's really about just alerting us that you are interested. We put you down into our system so that we can open the application for you. And as I had mentioned, because of all the work that you've already done in clinical pathways, we've created a fast track for you. So when you go into the online application, it will say, are you implementing clinical pathways? Yes or no. If you say yes, then you get the shortened version of the application. I can't even say it's going to be fantastic. It's half the questions. And so once you send it in, we have a review committee. This committee consists of about 5 to 6 individuals, review all of them independently, and we have a fancy scoring matrix for everyone's application. And what we'll do is we determine the successful applications based on our scoring matrix. And then we will inform, of course, everybody of their application. So different sections have a little bit different weighting, but I will say that because you have already implemented it or are already implementing clinical pathways, you already given preferential treatment, okay? Because you're already doing this work. And so you will get preferential treatment in this process because of the implementation of clinical pathways. These are some really important dates. So the first is we need your letter of intent by October 21st, because then what's going to happen after is Lali is going to put your name in the system, your email, and then she will give you access to the online application on October 22nd. You'll have about a month or so to complete the proposal. In the RFP, it basically tells you all the things that we're looking for in the application. And so when you go through the RFP, look to answer all the questions and you'll be able to complete this proposal in no time. So the deadline is November 25th. We will take the holidays and January to review and then get back to you in February. Once we get back to you in February, we will give contracts, and then the launch usually is held in April of 2025. Okay. And so if you have any questions, I would suggest that you email us no later than November 18th. Email Sitlali. Her email is here to my attention, and we will answer right away. So that is really the completion of the formal portion of our presentation. And now we can move to the Q&A time. So if you have any questions, I would suggest that you can unmute and ask your question, or you can put your question in the chat.